Welcome back, everyone. Tammie Colon is with us today from Mental Health Recovery Services. We're talking about Suicide Prevention Awareness Month, and we start out a little bit about you guys have coalitions around the area to help family and friends and everybody affected by this, but participation in those has been low. And I guess you made it a point too. It's a depressing topic. You don't like to saturate yourself with it, but it's so important. Is there reasons why you think the numbers are low?
I think just what you mentioned, right? I think everybody would like to contribute, but to make that commitment and to hear the stories and to become more familiar with, the prevalence in our community, that's a heavy load.
Yeah.
But it is so necessary to have the voice of the people. One voice reaches multitudes.
Sure.
And so the more people we have involved in helping spread the word and contributing their ideas to effective ways to educate and inform the community, the better.
Yeah, I think so. That's a very good point, because especially among young people where the problem is so prevalent these days, I like that idea of getting their voices in, even if they've not been directly impacted by someone they've lost or a family member. Those young voices are so strong. I think you've talked about that before, right?
They are. They're strong, and our young people are being impacted in greater numbers than ever. And with the social media platforms, it's almost impossible at least to not be indirectly impacted, right? So we really do need the voice of all of our community members, and we need their support, and we need them to participate, because we have the most influence. Those of us who are healthy, who are not experiencing that at this moment, we have the greatest amount of influence into changing someone else's decision.
Yeah, you talked about those young people. Those suicide rates are rising among all ages, but especially among that young group, right?
They are.
Yeah.
And it's sad and it's frightening, and we have to be able to get to them to figure out what it is they're struggling to manage and how we can effectively intervene so we can bring the message of hope and help, so that they can make better choices for themselves.
I think people, and we'll talk about this later on, but people talk about when you have depression and you're suffering from those kind of things, and if that's the triggering mechanism for suicide, I don't think people understand that. They think they've got the blues and they'll just snap out of it, but that's not a thing. It's when you get into depression, it can be all-encompassing, can it?
Yeah, it is. The disease itself is the disease of the brain.
Sure.
So now you're operating with, an injured organ, right? So the ability to make a good decision, even though you're in the midst of this disease, you're symptomatic, you're struggling, to leave that to their own accord is really extremely difficult, because we don't have that much control over the disease. The greatest impact we have is by giving them an opportunity to talk about what they're thinking without stigma, without negative reaction, without judgment, and offering compassion, and then offering the opportunity to help get them connected to resources.
We talked about the coalitions and getting more people to join. What's the best way to do that? Because we mentioned too, I think All-Glades County is the only one doing a walk this time around, just because of lack of numbers. If people want to get involved, what's the best way to do that?
Yep, so we have the information on our website. We also at passaah.org also has the coalitions, when they meet, how often they meet, and even if it's just to come, and even one time or multiple times, whichever a person is willing to do, anything contributing to that group of folks that can help guide their work and guide the interventions in our community is helpful.
Yeah. Very rewarding, as you said, too, to help out. All right. Thank you, Tammie. Appreciate it.
You're welcome.
Good to see you. Don't go away. Medical news coming up next on Noon Edition.